what we have already discussed in hematology, all topics which have been, I am telling for those who joined earlier, all topics which you are to perform hands-on during the exam, they have been completed. There are a few more topics, but which have to be demonstrated to you, should be demonstrated to you, but you don't have to perform, like ESR, PCV. There are some of these topics, but whatever you have to perform hands-on has been completed. In clinical physiology, we have done history taking and general physical examination of pulse and recording of blood pressure. Actually, pulse and blood pressure are within the purview of general physical examination as well as the cardiovascular system examination. What remains is systemic examinations: respiratory system, cardiovascular system, examination of abdomen, examination of central nervous system, and examination of nervous system. Nervous system, again, it is a bit lengthy in the sense it will itself take more than, say, 2 months or so if we go by the schedule. So 2 classes per week, 2 practical sessions per week, it will require 2 months, maybe 8 weeks, 10 weeks for that part. And a bit of amphibian physiology is there to be completed during these sessions. And there is no hard and fast rule from that on the division of these sessions. These are decided by the institution, the departments at the institution. So we have already done history taking and general physical examination. So history taking will not go much into much detail today. Even those who are new, more of it, just read it out from the books. You have to just get a simple idea about what is history taking. History here means collecting information, relevant information about the subject. Now, some specific points which you have to know. For the rest of you who have joined earlier, they should already know by now whom are we calling a subject. Yes, you sit and say. Those who have come to a clinic, better say those who have come for any medical advice. Anybody who is seeking medical advice is a subject. That means any individual who is seeking a medical advice, seeking some medical advice is a subject. Now, when should we call an individual a patient? Not everybody together, then nothing can be heard. Yes, if that individual
has some particular illness, then
if something is diagnosed, diagnosis means the establishment of some issue, some medical issue, then only that person should be called a patient, very strictly. Although these subject and patient terms are used interchangeably, usually we use the term patient, but strictly speaking, we should call an individual in whom any medical issue is not established, we should call him or her a subject. Like if we try to give an example of this situation, like somebody has just come for a medical fitness certificate. Actually, see, from the situation you can just understand it, that actually he or she is also not claiming some medical illness or not complaining of some symptoms. From fitness certificate for some, say, joining of some job or some, as you have also undergone this eye examination and all, because before joining the medical course, color blindness and these sorts of things are to be excluded. Okay, so these things, so that means there probably no medical issue will be established. As a medical fitness certificate is a medical legal document which has to be signed by a registered medical practitioner. So these things these things, there will be certain situations like this where actually no illness. So that subject should not be called a patient. Sometimes it may happen the subject thinks that, okay, I have these things. You will read about psychosomatic problems and all in the coming days. So the coming days of your medical course, all through this. So these things, sometimes people complain of something, but actually no very significant issue is established. So you as a medical professional you have the right to just conclude that no intervention is required. Okay, no significant issue has been found and no intervention is required. So that person should not be also called a patient. So a subject or an individual who has sought medical attention is a subject. If the subject complains of something, these characteristics, which features, or the traits which he or she complains of, like fever, I have been having fever for few days, I have having pain, I'm headache for 2 days, it is going and coming, most of the day it is, I have been having a headache for the last few days, or a pain in the belly, or I have having problems during walking, so my foot is aching after a bit of walking, okay, I can't swallow properly, okay, any of these, like these traits, which complaints, which are expressed by the subject to the medical professional, to the clinician, to the doctor, or maybe the paramedic, okay. What are these called, these traits? These traits are called symptoms, symptoms. So what is the difference between a symptom and a sign? Yes, you. Yes, you in the front. Yes. When did you join? October. Okay, sit. So do you know what is the difference between a symptom and a sign? We just uttered what is a symptom. Any trait which is expressed by the subject to the medical professional is a symptom. I am having fever, I am having headache. That means any bodily issue. Or I cannot, it may not be, strictly speaking, it may not be bodily. I am facing a problem in remembering certain things. This is happening for the last 1 month or 2 months, that I was not like this, but I am having difficulty in remembering very trivial things. These may be the complaints. So these complaints are called symptoms. So what is the difference between a symptom and a sign? SIG and sign. In medical terms, sign means, the word sign can mean various things. I am not talking of the English term. The medically, what is called a sign? So if you have joined in October, you should say this by now. And this topic has been done. Yes, do you know? You, yes. CTS. What is a sign? What is the difference between a symptom and a sign?
Observing by physical appearance. Any problem or not.
Physical appearance.
Means how is walking or observing the subject.
Yes, but what is the meaning of observing the subject? What do you conclude? Who is observing the subject? The clinician, the medical professional. So now what is, like symptom is the trait which the subject complains of, and sign is what? Good. So you could not explain it. Observing, then what? Observing, you observe something. Suppose you are a medical professional, you will become after a few years, 4-5 years, you will get a registration number and become a medical professional. So you observe and then you decipher something, you conclude something. Okay. So when the person will be asking, subject will be speaking, yes, I am having fever. What will you do? Check the temperature. So this temperature is the sign. If a subject complains of, I have having pain, say, he points to his upper part of his belly and say, I have having pain here. What you will do? What will you do? You will check that part with your hands. You will press that area. Okay, are you having more pain? The subject will maybe speak verbally. Speak out. Yes, I am feeling my pain is increasing when you press. Or the subject will utter something like ouch, like this. That gives you that that is the identification that okay, the pain is more when I press the area. So that thing we call as tenderness. So this tenderness is the sign, but pain is the symptom. Fever is the symptom. Temperature is the sign. Okay. So this is the difference between symptom and these certain things you have to, these certain terms you have to know. So subject and patient, symptom and sign. History taking and here history means that information, collection of information about the subject. So as you see, the subject will complain of something. If this is a say outpatient department setting, the subject will come to you and complain of something. If he has already been hospitalized, if he or she has already been hospitalized, maybe I think you were the senior consultant, so your junior has already hospitalized him or her. So maybe now she can be without any medical issue. Why should he or she be hospitalized? So probably at this point of time already that individual can be called a patient. So now you visit him again. You already maybe somebody has gathered the history and written the notes, or you have to take it. So that history means the information. So it includes from the beginning, it includes firstly the patient particulars. Now in already been hospitalized, or if you are in an institutional setting, this patient particulars mostly will be already be documented before he or she reaches you. That means he or she reaches the medical professional. Like first is name, and name is only for identity. Okay, name is just for identity, but whatever the rest of the particulars like age, sex, occupation, address, all these should be documented. If the occupation is not documented, you are to document that. So all these may be in some way related to the illness. Age, sex, age, illnesses, certain diseases, illnesses, certain issues are really related to the age of the subject. Like certain issues, like say if you talk of pediatric asthma, pediatrics is this branch of medicine which deals with children. So from the pediatric asthma, from the name it comes, so it is asthma, the disease asthma itself, but there are certain differences to be remembered. So that is in children. So it depends on the age. There are some diseases which are related to senility, old age. So age is important, gender is important. Okay, there are certain diseases like if you know of sex linked recessive diseases, like we have already just discussed a bit of it, hemophilia. Hemophilia in hematology we have discussed a basic 1 or 2 lines about hemophilia. That is a disease carried in females but expressed only in males, usually expressed only in males. So gender may have some relevance. Occupation, how they may have some relevance. Occupation, so some certain respiratory diseases. So certain occupations, due to the nature of the work, the nature of the workplace and all, they are prone to develop certain things. So these are occupation may be related. Address may be related how? So a person, all persons in the city of Delhi are diseased, like this. Even in Bolpur, AQI was very high in the last 1-2 months. So not only that, there are certain, so say a person coming to you from a slum area, there are the conditions of hygiene and all this environmental pollution. Yes, cities. What he told AQI, this is city based, very congested cities and towns. So this is a problem. So a person living in some area where there is no, so that has that relevant additional information has to be collected. Even no proper water supply for drinking water supply. So all these things are relevant. So these whatever information you collect to establish the medical issue or to relate the medical issue of the subject is included in this history. So that is, but the patient particulars are also important in this way. Only among the patient particulars, name is not relevant to the illness or physical issue or medical issue itself. Name is just for identity, but all other things are relevant. Now after patient particulars comes, you have to, the person, sometimes a subject complains of various things, goes on, I have 15-20 issues. But as a medical professional, your job is to just gather what is relevant, mostly relevant just now, just at this point of time. Like he will say me, I have having some, I'm not feeling, I am not feeling that I get tired. I usually get irritated. This is happening for the last 3-4, say 3-4 months or 1 or 2 years. So this is also important to address. Not that this should not be addressed, but particularly he or she has come says for fever for 3 days along with lot of body ache. So for that point of time, that is more relevant. So you note that down as chief complaints, and rest also you note down as history of present illness. Okay, history of present illness will elaborate the chief complaints as well as it will mention the associated complaints. So patient particulars, chief complaints, then history of present illness. In present illness, you elaborate the chief complaints and also the associate complaints you note down. After that, history of past illness, any relevant past history which you can gather. Okay, I had a major surgery in the past. I had a major medical which I had to be hospitalized in the past. So as you gather experience, we will not talk much about it now. As you go on gathering from the next year onwards, you will have to visit the wards regularly. So wards and outpatients department, of course. So you have to. That means you have to be in touch with actual patients regularly. Patients or at least subjects who have come for medical advice. They have to meet them. This history you have to take. They have to gather the information. These things you have to do next year onwards. So what you will do is this history of past illness you will note down anything which may be relevant. Okay, so that's history of past illness. Then you have to take any family history, especially in case of hereditary diseases. Family history is important. Okay, so family history, history of personal history, they call something like personal history, like these things, and history of addiction. Yes, okay, smoking, addiction to alcohol, all these things, all this whatever information can relate to some medical issue that you have to gather. So when we study it first for beginners, we study it under certain headings. When you actually become a medical professional, so you will write a prescription, say 1 page or 2 pages. So it is not actually very required to write it like these headings. So you just mention whatever is important. But during learning, you have to, why we learn it like this, to remember that yes, so that we can remember well that yes, I should not miss this, I should not miss this. So see, during the first few years in your medical school, after just you pass out, you go by this detailed history you take and try to note down. As you go on gathering more and more experience, yes, obviously you note all relevant points, but you don't have to write like you are writing a answer for in an examination. But now you have to learn like this, that we must not miss these points. So this is a bit on history taking. We will not go into much detail and not required in your first year. You just have an idea what should I do from next year onwards. But it has been included in your syllabus. If you go from the exam point of view, it may be asked in your physiology exam. That what do you mean? Say what do you mean by history of present illness, or what is the importance of a occupation in a subject's history taking? So these things you may be asked. Usually these are not asked as questions in the theoretical exam, although questions from this whatever we are discussing here, some practical based questions may be asked in theoretical exam, but usually these are not asked in the theoretical exam. These are asked during the clinical physiology part of the clinical viva, practical viva exam. About after history taking, we should proceed to examine after gathering some info. Actually, you as medical professionals, you see, after you become a medical professional and gather experience, or probably you will be not wasting time with a subject. Okay, with a so whatever you have to do judiciously. You are examining a subject and simultaneously talking to him or her. Now, in case of very young children, it may be the mother or the guardian will be providing the history. In case of adults, usually it is better to take the history from the person itself, but maybe sometimes the person is having some psychological issue or he cannot communicate properly. So, that time there has to be an accompanying person who is providing this relevant details. In about general this physical examination, first of all you should know about some criteria which are to be maintained, like the area where you are examining or where you are dealing with this subject who has come to you for an advice should be well lighted. This is obvious. Okay, should be well lighted, and certain parts of the physical examination will be there. Without proper light, it is not at all possible. Proper lighting, like jaundice is seen in daylight. Okay, that means EOLO is discoloration of eyes or skin, ideally seen in daylight. If not possible, then if it is not daytime, then very bright light has to be there so that it can be examined properly, it can be made out properly. That is the importance of well lighted area. And as far as practicable, ambience has to be good, it should not be very a noisy area, all these things. But more important are, and also important are the comfortability of the patient, you or the subject rather. You ensure the patient make himself so that he or she feels comfortable. You have to take his or her consent before proceeding for physical examination. And if the subject is a female and you are a male clinician, then there has to be a female attendant. If the subject is a male and you are a female clinician, then there has to be a male attendant. Okay, and proper exposure is needed. All these are criteria. Proper exposure of the part of the body to be examined. Okay, proper exposure. Like in case of respiratory system examination, the chest has to be exposed. Okay, chest and the part of the abdomen has to be exposed. And you should usually we examine a subject from the right hand side. This is a convention. Most of us are right handed. Some, even if somebody is left handed, examination is possible from the right hand side. There are certain situations there where you may have to go to the left side. Usually this is done from the right hand side. So these criteria are to be maintained when you approach a physical examination. Now what are the points to note? That is, again, when you become medical professionals, you will do according, we should not say according to your sweet will, but according to a, you have a plan. How do I examine? Okay, you examine from head to toe, but basic physical examination you do from head to toe. Like when you see the eyes, you look at every possible, whatever comes to your mind regarding the eyes, you note that down. Just as beginners, we should learn it as what are the points to note. Okay, like whoever have already attended this class. So this is, we start with, no, we do not start with pulse. Whenever we observe a subject for the first time, even without touching him or her, I mean touching or feeling, this touching or feeling is called palpation. There are certain these points which we can, or certain, these should not be called categories. These certain aspects which we relate to clinical examination. These are 4 things we speak of: inspection, palpation, percussion, auscultation. This feeling, touching or feeling the subject is palpation. So even without touching the subject, just by observing, that is called inspection. So as soon as I see a subject for the first time, what can be made out even with a layman's eye? That general build and nutritional status. General build. Okay, to measure the nutritional status, we should use a measuring tape also from outside and measure the arm circumference, chest circumference, these things. But even just looking at whether he is very lean and thin, he or she is very lean and thin or very obese, an obvious scar mark in the exposed parts of the body, say over the face, these things can be made. So general build and nutrition, general appearance. Okay, the subject is looking very, say, at that point of time, say, anxious of something, very afraid. So it can be made out from the face. These things we first note. So this is, we call it as general appearance, build and nutrition. So that should be the first point to note. Next we talk of the vitals. Vital signs which are called the vital signs. So we will mention the word sign here: pulse, blood pressure, respiration and temperature. Not respiration, it's respiratory rate. So for counting the respiratory rate, the subject has to be exposed. Actually, ideally should have to be exposed. The chest and the abdomen, and the respiratory rate has to be counted. During counting of respiratory rate, we usually try so that the subject is not aware that we are counting the respiratory rate. We keep an hand on the pulse, radial artery, as if we are counting the pulse of the subject. Otherwise, the subject may become, that means if he becomes aware, his respiratory rate may change. Temperature we see with the back of the hand. Clinical thermometer should be used. Back of the hand on, say, on the forehead, on the nape of the neck, like this we see the temperature. But actually, core body temperature, a clinical thermometer is needed to not exactly, but as near as possible to the core body temperature can be measured if we take the rectal temperature. Okay, but practical situations, that is usually not done. It is measured under the tongue. Okay, this is the temperature in the oral cavity or under the armpits. These are under the tongue. It is varies 1 to 2 degrees. Actually, it is lesser than the core body temperature. So that's how to measure with a clinical thermometer. But just by palpating, we can do it with the back of the hand. But that will not give us a quantitative idea. That will just give us a qualitative idea when the temperature is raised, or in certain cases maybe lowered in some cases. So, but the temperature, whether it is normal, that has to come by experience what is normal. Okay, like in pulse, we have already spoken about it. We'll just again practice today that what is pulse, what to note in pulse: rate, rhythm, volume. Okay, condition of the arterial wall, delay or equality. So this volume of the pulse, this comes by experience. What is normal volume? So in the first year now, you take your own colleagues as your subjects, and probably all of us are healthy. So what is normal volume pulse? So that you can differentiate with high volume or low volume pulse or very feeble pulse when you go to the wards, when you examine the patients from the next year. So after these 4 points, we say 1, 4, 5. The next 5 points are pallor, cyanosis, jaundice, clubbing, edema. So pallor is paleness, jaundice is yellowish discoloration. Full definition I am not, I think you maybe already know, GI system is done. So what is jaundice? Yellowish discoloration when it happens, when bilirubin goes up 2 mg%, that is. So yellowish discoloration. Pallor is paleness, clubbing is loss of onychodermal angle, this angle between the nail and the skin adjoining the nail, loss of onychodermal angle, that angle is obliterated. So it can be seen. Okay, we'll see there how it is seen. You should already know by now. Pallor, cyanosis, jaundice. What is cyanosis? Again, bluish discoloration of the skin and mucous membrane. And edema is accumulation of tissue fluid. So usually first we learn how to see there will be edema, tissue fluid accumulated in various regions of the body. We talk of pedal edema, sacral edema, etc. At least first we should learn how to note for pedal edema. So it is few centimeters above the medial malleolus and how to press it and then release it. So edema, pallor, cyanosis, jaundice, clubbing, edema, and neck veins and neck glands. So these are the points to note in general physical examination. So this is about history taking. Whatever, and pulse and blood pressure is within the purview of general physical examination itself. In this time, for the first internal assessment, you will have this much will be asked. This much is the syllabus for clinical physiology part of the practical viva examination.